one. Welcome everybody to the Peripheral Neuropathy Success Webinar. You're in the right place, no question about it, at the right time. And we're going to share a lot of the right information. That is not hype, that is fact. And you could judge us on that one simple fact by the end of this webinar. So we're going to go at a good pace here today, and we are ready to begin. So a couple of quick little notes here before we start. I think it's prudent. How do you like that word? I think it's important that you guys take notes. I really, really do, because we're sharing new content here today. And I know if I write something down, then I could store it so much better in the corpus callosum. You didn't know I was going to use all these big words today here, but this is a neuropathy webinar, so we're going for it here today. So please, please, please take some notes. You don't have to take a lot of notes, but if there are some things that you see that resonate with you, that you can plug and play in your practice today, then please, please, please write it down. And what I would suggest is this, because this is a webinar that, although we are attempting to record it, we are. Historically, if you've followed us before, sometimes we do that, and then from a technology point of view, it does just the technology. You know how the webinar world works. So I'm going to tell you that we're treating this as a one-time webinar. So please, please, please make sure that if I'm you, I am closing out of Facebook. I'm not taking text. I'm shutting my phone down. I'm locking the door. And I am going to be all in on this, because this content is just way, way, way too important to miss. And we want to make sure that you come away better here from this webinar. And if you know what time it is, you know it's that magic, magic moment to get it rocking and get it rolling. It is time to learn. So what I would suggest is this. What I would suggest is that the absolute most important thing that you can do on this webinar is to do one simple thing, and that is this. And I know I've got a lot of our doctors, our family of doctors are on this webinar, which I'm so incredibly thankful for. And after seeing you guys this weekend, and listen, the party just keeps getting better, as you know, and that's why you're on this webinar. But we got a special treat for you. We're going to suggest this. We're going to say that at this point right now, that you make a mental note that you stay until the very, very end of this webinar. We have an amazing, amazing bonus that we have never, ever done before. And I think the bonus alone will blow you away. If you ever watch our webinars or listen to them, sometimes the bonus is like the most, the best thing. I'm going to tell you, this is the best bonus I've ever seen, because it's so unique and it's so different. And you can get your hands on this ASAP, which is pretty cool. For those of you who don't know, my name is Dr. Perry Bard, and I have been treating neuropathy patients for actually over 33 years. I have owned upwards of 5 clinics, 4 at one time. Then I sold them off as a group. Then I opened another one, and then I sold that one off. And we're having the time of our lives here. I'm a CEU instructor for states. I lecture for certain states. I also teach at something known as the National Spinal Decompression Certificate Program, which is held at a couple of universities. I'm also the co-chairman of the International Disc Educational Association. But this is not about me. Guess what? It is about, you know what this is about? This is about the next doctor, which is Dr. Eric Kaplan. And Dr. Kaplan, I could do an entire webinar times like 10xxx and talk about his background, talk about his history, talk about what he has invested in the doctors that are so fortunate enough to be in his universe. And he's the deal, and he is the real deal. And I'm so thankful. There's not a day that goes by. There's not a day that goes by where I don't get up and I don't and not say thank you for something that happened actually 32 years ago. That I was actually, for a lot of you that don't know, I was actually Dr. Kaplan's associate doctor 32 years ago, and the moon and the stars got together, and all I can tell you is it's been magic since, and the party just kept getting better and better. So I can rant and rave how incredible he is, and especially after this past weekend, what he did this weekend was historic. If you were in the room, you know, doctors, what I am talking about. We together, we also teach the only university CEU certificate program in the world of non-surgical spinal decompression, and now officially peripheral neuropathy. These are the only university certificate programs that exist in the world through chiropractic colleges. We're so honored to be given the opportunity to share the latest, greatest content with the doctors, and that's why you are on this webinar. And we just had an amazing thing happen this weekend. And what we did was we actually made history. And what you're looking at here is a group of historic doctors that actually attended this past weekend the first ever National Peripheral Neuropathy Certificate Program. This program here was actually done at Parker University this past weekend, and it was groundbreaking. And if you go by some of the text and the emails and the comments, I mean, I've never seen doctors more electrified. Isn't that pun intended, really pun intended, that I've never seen more doctors electrified in this information than ever before, because they see the potential. They know how important and vital it is that you position yourselves correctly to treat this market. And we had a blast. And I'll tell you something, I've been around him for 32 plus years. I have never seen him more on fire than this weekend. And he was just loving life. I'll tell you, if you were there, you know there were new jokes. They were all, my abs were hurting. They really were. New jokes, crazy, but he just, he left it on the field. He just gave his heart and soul to this profession with respect to the simple fact that these doctors are coming away better, empowered, more knowledgeable, and better positioned to take care of peripheral neuropathy patients, because you would be shocked and surprised how many of them are out there. And we had a blast. The reason we had a blast is we also had a team with us of some of the absolute best neuropathy doctors in the country. And these guys are kicking butt. I mean, these guys, if you saw how large and in charge these guys are, and I'm not just talking about the millions of dollars that they are making, that's a bonus. These guys are great doctors because their attention to detail is incredible. And you may have an opportunity, actually, if you hang out to the end of this webinar, you actually might have an opportunity to meet these doctors and more in a very unique environment. So I'm going to suggest that you wink, wink, you make sure that you hang out. It was just one of those things. Did you ever teach a class and you just knew that everybody was like really into it? It was based upon a lot of the questions they were asking. We had a little get together at the hotel thereafter, and we were able to actually present some certificates to some of the doctors that are really, really doing it right. And they are capturing peripheral neuropathy, the peripheral neuropathy market, in such an awesome way. And the reason why is simple. The reason why is because these doctors are no longer, as we would say, the middle class of chiropractic. In other words, the middle class of chiropractic essentially has evaporated. And what we mean by that is this, which I think a lot of you already know. The middle class of chiropractic is no longer in the sense that you have doctors now that are making more money, treating more patients, getting better results in the world of being a nerve specialist, being a spinal disc specialist, being a joint specialist, and more. And then you've got the other side, which I think is interesting, where you've got doctors that are struggling. I mean, really struggling. I don't want to say they're living hand to mouth, but I'm going to say that they're checking their collections. They can't wait for the postman to come, because hopefully the postman brings them a check. Well, the truth is, if you look at our model, and if you look at the model we teach, and you look at the doctors that I'm talking about that you'll see here, these are the doctors that are running a cash-based practice. 100% cash. Now, yes, there may be some doctors that want to do an integrated model. When I say integrated, meaning part cash, part insurance. The truth is this. The truth is very simple, that you either involve yourself and become an all-in doctor, or you run the risk of letting the universe deal you the hand that I guarantee you're not going to like, because it'll be too late to make any changes. Now, that's not fear, but if that definitely puts a fire under your butt to take action, trust me, believe me when I tell you that there are so many great opportunities for you right now, big if, you take advantage of them. So let's talk a little bit about peripheral neuropathy, because that is the theme of today's webinar, which is that peripheral neuropathy is actually two separate things. And what it is really peripheral neuropathy is both a condition that is something known as progressive and degenerative. Now, how cool was it in the room when you guys were here with us this weekend and we had one side of the room screaming out progressive, and then we had the other side of the room screaming out degenerative, and then we did it like fast. So I loved it because you guys were so enthusiastic about it. But the reality is peripheral neuropathy is a condition that left untreated will get progressively worse. If left untreated, it'll reach a point where there may not be any further options for a patient to be able to exercise. And this is important in the language, because when you present the cases, I presented cases to neuropathy patients for all these years, this verbiage is in every new patient consultation that I've ever given to a neuropathy patient. So it is that important because patients will understand this. First of all, I think it's vital that they actually understand what it is. And when we talk about apathy, apathy is actually a suffix that denotes a disease or disorder, as in neuropathy, a disorder of peripheral nerves. Now, if you go back to your basic sciences, if you remember when you took the study of pathology, which often in medical schools, if you ask medical doctors, and there are medical doctors on this webinar right now. Good to see you, Dr. Cliff. Welcome back. Very cool. There are medical doctors actually on this webinar right now, and they are on this webinar because the truth is this: they're looking for better, more viable options to be able to treat these patients, and that's why they're listening to the same content that you are, doctors. But if you remember in medical school, one of the most, really, if you ask most medical doctors, they'll tell you the toughest course was pathology. The reason pathology is because it's the study of what? It's the study of disease. And that can go in a lot of different directions. If you look at the Merriam-Webster definition of neuropathy, they say it's a disease or dysfunction of one or more nerves, especially of the peripheral nervous system, that is typically marked by burning or shooting pain, numbness, tingling, or muscle weakness or atrophy, and it's often degenerative, and it's usually caused by injury, infection, disease, drugs, toxins, or vitamin deficiency. All of those things can cause a dysfunction with the nervous system. So the reality is, what is peripheral neuropathy? Well, peripheral neuropathy is actually a term for damaged nerves in the peripheral nervous system, not the central nervous system, not brain and spinal cord, but the periphery. Peripheral neuropathy can be caused either by both diseases of the nerve or can develop as a side effect of a systemic illness. Now, this is important because as doctors, it is vital, it is crucial that you draw a line in the sand as to what the actual causation of your patient's foreign peripheral neuropathy truly is. Is it a spinal structural dysfunction? Is it a biomechanical dysfunction? Or is it more of a metabolic issue? And this is the fun of being a doctor. I think it's one of the great parts of being a doctor is to do the differential diagnosis correctly, to rule in and rule out utilizing the proper test. We'll talk about that on this webinar. If you've ever attended a class that we teach, which is the National Spinal Decompression Certification Program, what we always say there is all roads lead to disc, meaning although a patient may be presenting with symptomatology that may mimic back pain, the reality is, at the end of the day, if you look at what can happen to a spinal disc, how it can degenerate, it could bulge, it could herniate, it could sequester, it could protrude, it could prolapse, it could do a lot of things, but it all starts with the subluxation. Yes, this is an above-down, inside-out agenda because of the simple fact that I think you have to look back to look forward. So everything starts with the subluxation. But left untreated, as you know, it has the potential to become progressively worse. Now, I don't know if there's a chiropractor in the universe, actually even on this webinar, that doesn't use some form of this poster. And when I say that, what I mean is the classic phases of spinal degeneration. This is where it starts. Now, the interesting thing is, if you could show me a misalignment of a bone that doesn't put pressure in some which way, shape, or form on a disc, I would love to see it. You know from physics, doctors, that when the motor unit changes, meaning the bone, the disc, and the nerve, As a result, there will be less function. There will be less than 100% potential. There will be less of an electrical signal. And guess what? We're in the electrical business. We are, at the end of the day, we are electrical engineers. We really, really are. Whereby, if you think about it, what's a medical doctor? A medical doctor is a chemical engineer. We are spinal structural engineers as chiropractors. And at the end of the day, the truth is we're really electrical engineers. If you remember going back, because we got to take one step back to take a giant leap forward, that if you remember the work of Chang-Ha Su, remember PhD, this guy really was one of the most unique names. If you remember, when I went to school back in the golden era, yes, it's true, 1983, 1984, 1985 and beyond, that you heard this name. And what was interesting was this statement, that the weight of a dime on a spinal nerve will reduce nerve transmission by as much as 60%. So think about it for a sec. I mean, think about the simple fact that you have this incredible and elaborate electrical system, and it could be infringed upon in so many different ways, either from a biomechanical point of view or from a metabolic point of view. So if you now look at it with respect to that, this is not just a hard bone on a soft nerve issue. This is a nerve condition often caused by a subluxation, a bulge, a potential herniation, or a neuropathology. Now, with respect to treatment, we approach the treatment of peripheral neuropathy from three main avenues. And the way we do that is in the form of electroanalgesia, in the form of LED therapy, and in the form of laser therapy. But don't be fooled. And when I say don't be fooled, it's not a canned approach. In other words, there's actually a number of other things that we've added to the recipe here to maximize patient outcomes. The reason that you're on this webinar is to maximize patient outcomes. And yes, to grow your practice. Absolutely 1000%. If you look at some of the common warning signs of neuropathy, they are the most common with respect to tingling, pins and needles, burning, numbness, cramping, loss of balance, and more. If you look at actually the epidemic of peripheral neuropathy, that up to 22 million people actually suffer from peripheral neuropathy. In other words, 1 out of 5 people will be affected by peripheral neuropathy. So this is a captive audience. This is actually an audience that's not going away, quite the opposite. What's happening is this audience is growing exponentially, and I think you know a lot of the reasons why. We're going to talk about those reasons here on this webinar. I don't know if you know this, but maybe some of these names sound familiar. I love watching Andy Griffith. Actually, I watch MTV, and I love watching the old shows of Andy Griffith and Opie and Aunt Bee and more. But guess what? He suffered from peripheral neuropathy. Johnny Cash as well. Mary Tyler Moore. Now, here's an interesting thing. When I grew up, I would tell you that, tell me if you agree with this statement. When I grew up, that when I heard the name Mary Tyler Moore, and she had this great show. Believe me when I tell you, I used to spend Saturday nights watching this show, which told you about my social life going back years ago. So it was about this gal right in Minnesota, and she worked for a news agency. But that's not the important issue. The important issue is I actually knew back then that Mary Tyler Moore was one of the first actresses to actually share that she suffered from, unfortunately, diabetes. And I don't know if you remember that. In addition to that, there are other ones that have come out with respect to acknowledging the fact publicly that they've dealt with this. Glenn Beck, Cedric the Entertainer. I just watched this great Motown thing he did, and violinist Brian King Joseph and more. Here's an interesting one. I bet you didn't know this. I bet you didn't know that even Eric Clapton, slow hand himself, actually has dealt with peripheral neuropathy, so much so that it's affected his touring, so much so that he's canceled tours because of it. Now, here's an interesting thing. He says it feels like electric shocks going down your leg. But you know what I do when I look at pictures of Eric Clapton? You know where I look? I look a lot of time at his hands. And did you ever notice patients with rheumatoid arthritis? You know what I'm talking about. A lot of times their hands are disfigured. in a very specific way? Well, when you start to look at your patient's hands more, you can go out in social environments and you can see this. And I promise you that if you look closer, you'll see it. There's an old saying. And you know who's famous for this saying? I love this saying in the fact that it is actually Dr. Kaplan. I don't know if he does a lecture and he doesn't share this important fact that when he says to his audience, which is, you know, if you could see the invisible, you could do the impossible. And that's a very powerful statement. We want you doctors, as a result of this webinar, seeing the invisible. We want you seeing what other doctors are not looking at. If you look at some of the other causes of peripheral neuropathy, yes, it can be from chemotherapy, which is now is way more common than any time in history. Any other type of organ dysfunction, kidney, liver, thyroid disease. Here's one of the biggest ones, the statins. In other words, the cholesterol-lowering drugs. So one of the first things that we do in our clinic is we get a profile. You should know every drug that your patients are taking. Every drug, because that should actually give you a heads up. In other words, you know what it's like? I'll give you an example. It's like having a playbook. Before you put your offense on the field, how cool is it to know what plays have already been running for the other team? Do you know what I mean? In other words, the other team being your patient, and to be able to modify your game plan accordingly. If you were sitting in the room this weekend when we taught the National Peripheral Neuropathy Certificate Program, one of the slides I showed, I don't know if you remember, but one of the key factors here to being successful in peripheral neuropathy is having the ability to do what we call calling an audible. And calling an audible means you're going to change the game plan for that patient. Here's an interesting one. How about patients that are obviously overdoing it in the alcohol realm? Did you know that B1, B6, B12, and vitamin D deficiencies can obviously cause peripheral neuropathy? So a lot of our training, a lot of our lectures are geared towards that, and especially post-surgical procedures. In other words, when they actually do orthopedic procedures and they actually take the nerve past the point of no return. Well, you can cause it that way. How about malnutrition? How about weight loss surgery, where now the patient, in terms of absorption, can no longer absorb the proper nutrients? These are some of the most common side effects of bariatric surgery patients. How many doctors are doing weight loss practices? How many doctors are catering to a larger share of the market? What did we do with weight loss? It's simple. We still do. We do dinners for weight loss. Imagine teaching your patients how to eat better and then teach them how to lose the weight all at a dinner. Well, we do that there, but I guarantee that if you have patients that are overweight that are attending these lectures, which is usually the norm, that there will be a fair percentage of them that are dealing with and or know somebody who has peripheral neuropathy. So anytime you have inflammation, that's why Crohn's, ulcerative colitis, irritable bowel syndrome, suppressing inflammation in the body is one of the most important facts if you're going to treat neuropathy. And that should be part of any nutritional plan. And there are other things that you could do in terms of technology, in terms of treatment, to suppress, lower, and eliminate inflammation. Did you know this? Did you know that 87% of all fractures in the elderly are due to falls? That 1 out of 5 seniors will die within 5 years following a hip fracture. Loss of balance leading to falls is a major risk factor for neuropathy. Now, for the doctors in attendance weekend, how cool was it to have that technology that we showed to be able to measure this? And it's so cost effective, but the reports were freaky good, right? Do you see the reports that you could show the patient? Now, here's my favorite thing about the balance testing. My favorite thing about the balance testing with peripheral neuropathy patients is that you do a pre, you do a post, and you do it throughout their treatment, because this way you can document their improvement and you could show them in black and white, because getting balance back is crucial. I'll guarantee this. I will guarantee that if you actually did some research and you actually dug in a little bit and you saw the amount of elderly patients that you're watching the news and you hear of the car going into the cafe, going through the window at the shopping center or the strip mall, I would bet that more than a fair percentage of these patients had peripheral neuropathy. In other words, they can't feel their feet anymore. Their sensitivity to their lower extremities is compromised. And as a result, now it's a safety issue. Now it's a life or death issue. Now, what age group does it affect? Well, I think there's a lot of doctors on this webinar that just simply say, well, gee, I'm just gonna go after the diabetes market, and I'm gonna tell you that you can do that. But the real secret here in terms of capturing larger market share is the pre-diabetic market. And that's what you want to pay attention to. I think it's interesting to understand that there are certain nutrients which are important that you must put your patients on. But if you just simply change their diet, as you know, that's not going to deal with the complete cause of the problem. You have to attack this 5 different ways. And that's the fun for us of treating peripheral neuropathy patients, because we attack every avenue that we can there. And that's why our results for our patients are radically better than so many other clinics, is because we're looking at it from a comprehensive point of view. What I would always suggest is always go back, take one step back to get more familiar with the anatomy. And I know what you're thinking. You're saying, wait, I've been in practice for 20 years, doc, man. I don't need to go back. I took that stuff on my boards. Well, guess what? It never hurts to sharpen the saw. It never hurts to become more comfortable in this. It never hurts to become a better communicator. It never hurts to understand that the nervous system is actually made up of 3 different parts: the motor, the sensory, and the autonomic. Now, the reason they call it autonomic is because autonomic is a keyword for automatic, which means it regulates the automatic functions of the body, including, as you know, blood pressure, bladder control, perspiration. That is autonomic or automatic. But here's the interesting thing. The motor nerves control the muscles of the body. Now, I don't know if you're the same, but for years we tested both sensory nerves and motor nerves. In other words, not only did we test it, we would break it down in terms of actually checking both components. And what was interesting is, remember, there's always, when you do the test, it was always a professional component, and there's always a technical component to the test. Now, I might be taking a step back, obviously, because you're saying, well, gee, he kind of sounds like he's talking about an old insurance model. Well, yes and no, because the reality is that there are opportunities here to be able to utilize insurance benefits for diagnostic testing in certain locations, in certain states, and certain demographics. But please understand, for the purposes of this webinar and our trainings moving forward, this is a cash-based model. This is not an insurance-dependent model. And guess what? That's better for you, and it's better for the patients. Understand that the 3 most common types are what we call mononeuropathy, which generally affects one nerve, polyneuropathy, and then mononeuropathy multiplex. And a lot of times what you'll hear is something known as glove and stocking. I don't know if you've ever heard of that term, but glove and stocking neuropathy is actually the distribution of how it's being affected. That's another term for peripheral neuropathy. So just in recapitulating, I don't even know if I ever used, that's a big word from a kid from Brooklyn. Recapitulating everything we've spoke about so far is that neuropathy is a common complication of a number of different medical conditions. In other words, it's not just one cause. It can involve the autonomic nerves, the motor nerves, and the sensory nerves, and obviously trauma, repetitive injury, infection, inflammation, metabolic problems can all increase the risk, as well as diabetes and the pre-diabetic market. I think it's vital that you also use terminology that comes from the AMA. And the one thing that I would tell doctors, that if I've seen doctors make a mistake anywhere, and it's funny because Dr. Kaplan and myself often discuss this, that, the largest practices in the country, what they don't do, let me tell you what they don't do. What they don't do is they don't medical bash. All right. I'm going to suggest to you that if you're doing that, that you elevate what you do, elevate the strength of your practice. Trust me on this. You've got better options. If you're using some of the tools that we teach at our trainings, on our boot camps, and our certificate programs and more, which we'll talk about on this webinar, then you will, doctor, get the big idea and more. So it is vital to understand that this is not, I don't want you to just think about, the reality of that it's just diabetes, because yes, we actually have a marketing campaign that's actually geared toward the podiatric market. And the podiatric market is the podiatrists that are really having a real challenge with this condition and are looking for much more viable ways, safer ways, gentler ways, and more successful ways to treat this. When we talk about mononeuropathy, what we're really talking about is a single nerve. And it's important to differentiate a polyneuropathy versus a mononeuropathy. All right. Now, the most common cause of a mononeuropathy, I think you guys know this, is a physical compression of a single nerve. Now, the most common, the one we've dealt with for so many years, and I know you guys deal with this too, is carpal tunnel. Now, you know what I love for carpal tunnel? I love laser for carpal tunnel. I love vasopneumatic for carpal tunnel. There's so many cool things that you can do for carpal tunnel, as well as tennis elbow and the golfer's elbow and more. So medial epicondylitis and lateral epicondylitis. I don't know if that sounds familiar, but at the end of the day, this is an inflammatory process of a single nerve as a general rule. Now, when we talk about peripheral neuropathy, we tend to talk about polyneuropathy, which affects the longest fibers first. And obviously, the symptoms, now here's an interesting thing, the symptoms almost retract or retrace. In other words, the symptomatology starts, as you know, on the periphery. So that's why they may not have back pain. They may not have neck pain, but they can't feel their fingers anymore. As a matter of fact, they're dropping glasses. When they pick up a hot tea glass, they can't feel it. When they put their foot on the pedal, they can't feel it. And this is a health issue. This is a safety issue. But guess what? You doctors are in a position to be able to do better for these patients. That's one of the great things about being a peripheral neuropathy doctor. So we often talk about how polyneuropathy, aka also known as peripheral neuropathy, it could be acute, it could be chronic, it could be static, it could be progressive. In other words, sometimes these conditions will start to ease up, but at the end of the day, if they continue to do the same things the same way, well, guess what? They're going to get the same outcomes. So what you must do is you must educate your patients in lifestyle management. Lifestyle management is one of the best parts of being a peripheral neuropathy doctor. The Cleveland Clinic estimates that 25 to 30% of Americans will actually be affected by peripheral neuropathy. Now, we're not talking about 3 to 5% here. We're talking about a large market share, which is not going away, which is only increasing. So these are not our statistics. These are the statistics from the Cleveland Clinic, and the statistics that we show our patients are generally from the Mayo Clinic, they're from Harvard, they're from Stanford, and more, because the last time I checked, chronic pain is not disappearing. In other words, chronic pain syndromes, the use of opioids with respect to Vicodin, Percocet, Tramadol, and more. How about fentanyl? It just keeps getting worse and worse. How about the old ones like naproxen and Flexeril and Soma? When I see patients come to my office with these types of pharmaceutical profiles, I know they are literally on a treadmill, and some of them are literally fighting for their life. And when they get to you, you doctors, yes, you may be their last best hope. So one of the things we do, one of the cool things we do is we start educating them on 3 common drugs. Now, the 3 most common drugs, as you know, are Lyrica, Cymbalta, and Neurontin. Now, we just gave away a whole manual that had the PDR effects. And PDR, oh my gosh, it took up so much of this manual because you can't believe the amount of side effects in it. So what we did was we made a free patient report that we give to our patients to be able to start to educate them. Now, I know what you're thinking. You're sitting there and you're saying, wait a minute, this is starting to make a lot of sense. In other words, all I really need to do is just see if they're taking Lyrica, Cymbalta, and Neurontin, and I'll know if they're a peripheral neuropathy patient. And I'm going to tell you that that would be a mistake. And the reason that would be a mistake is because as a doctor, you want to make sure that you know everything that you possibly can about your patients. So I love it in the fact that this to me is a starting point, but it's not an end point, because at the end of the day, if you can diagnose them better, then you can provide a much healthier, much safer, much more viable treatment option for them. The fact is that these drugs don't work. They just don't. The side effects are scary. And we're talking about gabapentin, and we're talking about drugs that are actually given, believe it or not, for depression. If you look into PDR, why did they make these drugs? I mean, I watch the TV commercials just like you, right? And what are they for? Well, what happens is, unfortunately, often a drug will come out, and then what happens is it will be prescribed for something else. That's not uncommon. The problem when you do that is often it'll cause potentially more problems. And I don't want you to think it just comes down to those 3 drugs. It doesn't just come down to those 3 drugs. It comes down to a lot of other drugs that potentially can even cause neuropathy. Antidepressants and cholesterol drugs, and obviously so many of the diabetic drugs and the anti-anxiety drugs and more. These are the drugs that have the potential to cause peripheral neuropathy, and you need to know that right up front. So what we do is, if you look at like our patient forms are like keying right into this information. I think it's an important fact because the U.S. actually consumes 75% of all the medications produced in the world. And that's not our statistic. That came from the National Institute of Health. And I think the most powerful thing when you start to read about this is that although we take 75% of all the medications produced in the world, we only make up 5% of the world population, which is, to me, I would say that when I see those numbers, I think we got a world that I think we have a situation known as we've got an addicted population here. And that's why as chiropractors, we are in the best position to be able to really connect with our patients face-to-face, one-to-one, eye-to-eye, and heart-to-heart. As many of you know, I now lecture for the Florida Chiropractic Association. Historically, I do very, very few lectures. Both Dr. Kaplan and myself only lecture for something known as a ChiroVent and then the certification programs for disc and nerve. We don't lecture anywhere else because at this phase right now, we have really focused 100% on the audience of chiropractors that are entrepreneurial, that are business savvy, and really want to make a change and grow humongous practices, but really become specialists. But this year, I started lecturing for the FCA as my gift to our state. And the reason I did that is because my son, many of you know, is actually in chiropractic school right now. So we wanted to give back. And one of the things I lecture on is actually addiction. I lecture, it's actually on spinal decompression, the ABCs. I lecture on addiction, and I also lecture on chronic pain. And believe it or not, all of that is in one singular lecture. Those are not like 3 lectures. That's actually one lecture. The Mayo Clinic, this is a very interesting statistic, that the average 45-year-old takes an average of 4 different prescriptions. Once you get to 65 to 69, it can be upwards of 15 prescriptions. Now that's an average. Seniors, 18 prescription medications. And this is, again, not our statistic. This came from the American Association of Consultant Pharmacists. So this is a big deal. And this is the market that is the most fertile for you doctors, for you to be able to go in there, make a change, connect with them, and have them walk out of your office as peripheral neuropathy patients better than the way they walked in. I think it's important to understand that your patients know that nerves have the potential to heal. Damaged peripheral nerves can heal, and they can be repaired. And once they are repaired, they can actually regenerate. There can be all these tributaries to nerves that can heal. Now, that's not uncommon. That's actually how the body heals. In other words, when vasculature closes off, because as you know, when you're assessing peripheral neuropathy, it could be as we mentioned, a biomechanical dysfunction. It could be a neurological dysfunction. It could be a metabolic dysfunction, but it also can be a vascular dysfunction. Now, did you know that once there's occlusion of blood vessels, case in point, when somebody goes for a bypass surgery, often that there are tributaries that open up now to be able to, capillaries opening up to be able to compensate for the failed vessels. And the same is true in the nerve world. And this is something that you can lecture patients on. You can educate patients. And again, not our research. And that's the best part. I love this in the simple fact that we're just the messenger The message comes from Harvard Medical School, Mass General, Washington University Medical School, and more. Nerves can regenerate. And I would bet if you showed your patients the facts, that 9 out of 10 patients or more would agree with that simple fact that damaged nerves, given the opportunity with the proper care, the proper treatment, the proper technology, in your office, doctor, in your office, can repair. So I'm going to suggest to you that if you ever want to do some research on it, absolutely, and include that. We actually include that in our patient packages now because we want our patients to know that there is a higher level of academia, a higher level of credibility that says if you do this, then you can receive that. In other words, if you get the proper care, the proper treatment, then these nerves can repair. Often, when you ask a patient, are you familiar with a limb reattachment? Have you ever heard of a patient having a finger severed and then having it reattached and having that finger work again? Well, this isn't new news. This has actually been going on since 1963. And I think pretty much if you watch TV, you might have heard those names on the bottom as well. And that's where, listen, at the end of the day, you have to be able to not take yourself too seriously, doctors, and to be able to connect with patients the right way by tapping into their emotions. If you remember this weekend, we spoke about two things. We spoke about, if you sat in the room, we talked about intellectual bonding versus emotional bonding. And I promise you, emotional bonding is much stronger. If you're leaving anything on the table, you have an opportunity here, doctors, to connect with your patients on a much stronger level, and understanding that there are so many different causes of this. So I don't want you to just, come away from this webinar thinking that, gee, it's just a hard bone, a soft nerve, or if they have diabetes. No, there are so many other potential causes, as all roads, doctors, potentially lead to, as we mentioned, they lead to nerves. And guess what? They lead to you. So the clinical findings, some of the classic signs and symptoms and presentations. You also know, obviously, that to diagnose this properly, the best way to diagnose this is through a comprehensive evaluation. Now, medically speaking, a lot of times the most common ways is to use something known as a Cadwell unit. I don't know if that sounds familiar to you, to do an EMG or a nerve conduction test, which is common, or a punch biopsy. Now, I will tell you that if you ever spoke to a patient that actually had a punch biopsy of a nerve, often they'll tell you the following things. Number one, that it wasn't comfortable. And number two, the nerve actually never felt the same after. It actually got worse. So what you want to do is you want to look at technology that can detect this in a non-invasive way. That's the preferred way. And this weekend, if you were sitting in the class, we spoke about the Semmes-Weinstein examination. We did the Berg balance test. And then also to understanding getting proper blood tests. I want to know what their blood sugar is. And I also want to know, obviously, if there's any underlying cause. Remember, the D in doctor stands for what? It stands for detective. So if you enjoy being a detective, I always did, I would bet you that virtually almost everybody, if not everybody listening to this right now, enjoys being a doctor because they like the challenges that it presents in the simple fact that not everybody's the same. And how cool is it to be able to deliver an outcome and a result to your patient that is better than your peers, better than any other chiropractor in your market? So what do? We use a combination, as I mentioned, of electroanalgesic. We use chiropractic adjustments. We'll do laser. We'll do LED. We also use something called rebounding. And it's interesting because if you were sitting in the room, we actually showed this, one of the most awesome doctors in the country. I'm not going to share his name on this webinar. I did it last time. Only if I share, what's going to happen is his phone lines are going to light up like last time, and he's too busy helping sick people get better. And then he just sends me a text yesterday that says, I just closed 3 neuropathy cases. I always come back on fire every time I come to a training or a workshop or a boot camp. And you know who I'm talking about. For some of you on this webinar, you met him this weekend. He is large and in charge, and he was jumping up and down. How cool was that on the rebounder? The thing that I loved about the rebounder is the simple fact that it is an immune booster. So obviously from a physics point of view, it makes sense. But when he, you knew his story, you knew his background, and this guy lives with his heart. That's why this guy's patients is his patients love him. His staff loves him. I could do a whole webinar on him, but I have a feeling you'll get a chance to meet him if you hang out to the end of the webinar. Yes, you know it's coming. I feel a tsunami of goodness coming on this webinar and more. So I think it's vital that you educate your patients on the simple fact that neuropathy is something that has to be managed. Okay, so avoid the word cure. Avoid the word correct. We always say, at our boot camps, we always say seize the day, right? And and it's a really play on words, because we say SEIZE, seize the day. And what that means is eliminate the words in your vocabulary that say, cure or correct. What do we like? We like the C words that say control, contain. And we can contain this for you, Mrs. Jones. You're in the right place at the right time. I'm glad we caught it when we did. And communication we had a lot of fun this weekend. We shared a lot of that goodness in terms of the verbiage of how we overcome objections and how we get to yes. It's one of my favorite parts of teaching it, as you know, because we had such neuropathy heavyweights in our room this weekend that really are in the trenches that are doing it. What did I talk about? I talked about how to shake the trees, how to get the party started, how to overcome objections and communicate better. I run with a good team. As a matter of fact, I run with the best team in the world, and I'm so excited. And that's why I never saw Dr. Kaplan so adrenalized as he was for this weekend, so much so that he actually created something for you that we'll share at the end of this webinar as we start to get a little closer here. And if you remember this chart, this was actually, what's interesting? 3 weeks ago, I lectured for the FCA, and I actually got a chance to visit one of the most progressive doctors in the country. He has one of the largest clinics. He definitely has the largest chiropractic sign I've ever seen. His LED sign is bigger than Home Depot's sign. I kid you not. And I walked into his office, and he actually lectured this weekend and did a spectacular job. You will meet him if you get an opportunity to grab a hold of what we'll share here. And he actually has this chart in every room in his office. He's a master communicator. And the one thing that he's not is this. He's not a dog chasing his tail. And there's so many chiropractors historically that have been doing it a singular way. In other words, they've been doing it one conventional way, hoping, wishing, praying that they get a better result. Well, I'm going to tell you that it's time to change. It's time to surround yourself with the most entrepreneurial, business savvy doctors that have nothing more than their patients' welfare in the front of their heart, in the front of their brain, and in the front of their hands. These are doctors that no longer want to be a dog chasing a tail. These are doctors that said, you know what? I'm going to surround myself with great doctors. I'm going to learn what they're doing, and then I'm going to start to plug in what they're doing so I can deliver better results. Somebody once said that the greatest marketing strategy in the world is to do one simple thing. I don't know if you ever heard his name. His name is Gary Vaynerchuk. Gary Vaynerchuk simply said, and this is the magic of Gary Vaynerchuk, is he takes the convoluted and the complicated and he makes it simple. And he said that all you really need to do at the end of the day is start to care more. Now, if you remember as chiropractors, we were always familiar with one simple statement, and that is that patients always want to know how much you care, doctor, more than caring how much you know. This is not about letters after your name. You can keep searching and searching until you find what you're looking for. And just like the Wizard of Oz, you've had it all along. You need to up your game. And the way you up your game is you do two things. Number one, you care more, and then you do something else. The second thing that you do is you start to communicate better. And the way you communicate better is you paint visual pictures for your patient. You use better analogies. You use better examples. If I've learned anything in 32 plus years with Dr. Kaplan, I learned one thing. And what I learned was how to tell the story better. If you can tell the story better, be it to a nerve patient, a disc patient, a joint patient, a chiropractic patient, I promise you, your conversion rate will go up, your close rate will go up, your capture rate will go up, and your profitability will go up. Because at the end of the day, this is an educational webinar, and this is a business webinar. And for the doctors that are listening, and I can tell right now that there are actually more doctors on this webinar than when we started, so nobody's left. Thank you for not leaving. I think you're having fun. You know I'm having fun because we're just getting ready to give you some golden nuggets that we've never done before. And before we do that, I just want to recap a few simple things. I want you to understand that if you think your peripheral neuropathy patients are like any other patient, they are not. Peripheral neuropathy patients are challenging cases. And that's why I have to tell you, historically for me, these are the most emotional cases I've ever taken care of. In other words, you might say, well, gee, they're elderly, you know, their emotions are already frayed. Well, guess what? Yes and no, because the truth is you don't get to be a ripe old age without understanding how to deal with one 4-letter word. You know what that 4-letter word is? It's loss. L-O-S-S. It's loss. I never met anyone of a ripe old age that didn't know how to come to grips with loss. So I'm not talking about just the physical sense in obviously the people closest to them, but I'm really talking about a loss of function. I'm talking about loss of quality of life. And if they're fortunate enough to get it back, well, guess what? They'll look at it completely different. You, doctor, are the potential savior for them. Not every neuropathy patient will heal at the same rate. It's vital that you understand that, and it's vital that you let them know that if you really, really underpromise and you really, really over-deliver, you're going to be home. And that's why that's fact number 3. Fact number 3 is underpromising and over-delivering has never been more important than any time in your life. You can't do it the opposite way. That's where most chiropractors have failed. And they failed because they compare these patients to other patients. Well, guess what? Disc patients heal differently. Joint patients heal differently. Chiropractic patients heal differently. But at the end of the day, they're all chiropractic patients because they're within our scope of practice. So we're not treating peripheral neuropathy in the classic sense. We're treating a chiropractic patient, but we're utilizing technology and treatments within our scope of practice in each individual state. And that's what makes this so incredible. Peripheral neuropathy patients need you, doctor, need you more than anyone. And most importantly, my favorite, fact number 5, they cannot thank you enough for attempting. The key word here is attempting to help them. They know it. They've been around the block. And if you present it the right way and you underpromise and you overdeliver and you titrate them in accordingly, and you start to do what we do, which is we don't do all the treatment at one time. The reason we don't do all the treatment at one time is because we have to have the ability to call an audible. We have to have the ability after 5 visits, 10 visits, 20 visits, plus to be able to navigate the patient's care, to be able to dial in exactly what we need to do to get them to the best place, which is a place of healing. And that's why I ask you this question. Are you a chiropractic center that just provides peripheral neuropathy, or are you a true peripheral neuropathy center that provides chiropractic? I'm going to tell you that the latter is the one that wins. When you start positioning yourself as a true go-to nerve center, as you become a true go-to nerve doctor, that also includes chiropractic in your mall of services, these are the practices that are multi-million-dollar practices. Not the former. It's the latter, the true peripheral neuropathy centers that provide services as a mall of healthcare that includes chiropractic. These are the ones that are winning the game. All roads, doctor, all roads lead to you. And the way that they lead to you is as follows. They lead to you through a host of different mediums because you see, neuropathy patients don't always present as neuropathy patients. They can come in as a regenerative medicine patient, a regenerative care patient, an anti-aging patient. They can come in as a pain patient. How many patients do you know that actually are addicted to nicotine, that have terrible circulation, that have been dealing with neuropathy for so many years? Yes, it is you are in the circulation business, be it neurologically, be it from a vascular component. And if you're curious, if you've never heard about us, don't feel bad. It's okay. It's okay. If you've never heard Dr. Kaplan, it's okay. If you've never heard my name, it's okay. If you've never heard of Concierge Coaches or Disc Centers of America or Neuromed Neuropathy Treatment Centers, guess what, doctor? It's okay. That's the good news. You want to hear the great news? The great news is now you, at least at the bare minimum, are conscious of the simple fact that there is a better way to be able to reach market share, better penetration, and to brand yourself. If we're known for anything after all these years, because as you know, Dr. Kaplan, former president, CEO of an amazing weight loss company. I don't know if you ever heard of it. It's called Nutrisystem. He is the king of branding. He understands the business model better than anyone. And this weekend, we actually just debuted our new tagline for Neuromed. And I will share it with you right here. Our new tagline is Unmatched Care Meets Uncommon Passion. That is the new tagline officially for our Neuromed centers. Now, often you'll see two different logos. One will say Neuromed and one will say Neurodoc. In some states, we are known not as Neuromed, we are known as Neurodoc. Now, please understand, this is not a franchise, okay? This is not a licensing agreement. This is a brand that we own, that we share with our family of the greatest doctors in the country that said, you know what? I don't want to be on an island by myself. There's no glory in being on an island by yourself. Trust me, I practiced on an island by myself. I showed pictures of how I started, and that was a tough way to go. Once I started wrapping myself around these brands, things started skyrocketing. And if you ask any of the doctors that use these brands, they will tell you the same. Being on an island by yourself is not where it's at. Otherwise, you end up like this guy. And who wants to be like this guy who's looking at a volleyball named Wilson, right? And saying, how can you not love this movie, right? Did you love this movie? Well, the truth is, when you're alone in this business, it's just going to take you a lot longer. Money is replaceable. Time is not. The most powerful thing that you have is time. So if we can help you, doctors, collapse time by putting you in an environment that allows you to accelerate your progress, accelerate your outcomes, accelerate your growth, accelerate your profitability, well, guess what? That's not a good thing. You know what that is? That's an awesome thing. The one thing that when I started years ago, I had to ask myself this question. The question was this, and it's probably a question that a lot of you ask yourself, and that is, as a doctor, are you a salesman or are you a savior? Now, they both share in common the letter S. I will tell you emphatically that I never, ever, ever wanted to ever feel like a salesman in my office. Quite the opposite. I wanted to do everything in my power, my control, to never look like a salesman. So what we did was we created marketing, we created tools, we created systems, we created protocols, and we created packaging that allowed our family of doctors to not look like a salesman, but to look like a savior. And what does a savior do? A savior saves his patients from narcotics, loss of QOL, and potential amputations. Yes, peripheral neuropathy patients left untreated that are suffering from often diabetes, they're losing toes. They are losing toes. And if you're curious what QOL stands for, I think most of you know that's quality of life. You're in the quality of life business. So much of this starts with how we market. And some of the fun for us in terms of how we market is the TV commercials. We showed brand new TV commercials this weekend. Guess what? We've got some in the pipeline that'll make your mandible drop to the floor if you see what's in the pipeline right now for neuropathy, because we're throwing the widest net we can for our doctors to completely dominate their markets. We showed these commercials this weekend, but the new ones are incredible. I love these though, because again, listen, it's like putting a chip on every number. You know you're going to hit because different strokes for different folks. People are stimulated by different stimuli. Then we talked about different referral programs, and we talked about how we can market to podiatrists and especially oncologists, because so many of these doctors are dealing with the after effects of peripheral neuropathy. And they need you, doctor. Right now, you are the best kept secret in your town in the neuropathy world. People don't know you exist. That's the truth. The truth is that you're just not out there to the level that you could be. And if you now start to do certain things the way we do it, in terms of how you market, in terms of how you position yourself, in terms of how you reach out to certain doctors and use our tools. These are gifts to our doctors. We love loading the pipeline. So we've got so many incredible things that are coming out in the next week. Not like a year from now, not like a month from now. I mean like in the next week, of ways to be able to reach out to larger market share, to be able to capture the market that you want in the neuropathy world. At the end of the day, what you want to do is you want to make sure, doctors, that you're getting your market, your demographic, your area, your town, your city, your county so pumped, so excited, so adrenalized to meet you, doctor, because at the end of the day, you may be their last best hope. But it is a crime, literally a crime, if you don't hit the gas pedal right here, right now. So if I sound like I'm trying to motivate you, I am, because I know if I can motivate you, I know if Dr. Kaplan can motivate you, and he is the king of motivation. As a matter of fact, he wrote a book on it. It's called The 5-Minute Motivator. Go to Amazon and get it. We give it as a gift on CDs to doctors that attend our trainings. I mean, it's a great book. But we know if we can move you one more degree to take action, that exponentially we've done an amazing thing, because the truth is we may never meet you. We may never meet you in person. And if we didn't, well, guess what? It's okay. It's all right. But guess what? If we do meet you, then you have an opportunity to learn something you've never learned before, because we're going to teach you one thing. What we're going to teach you is we're going to teach you how to get to yes. We're going to teach you how to be able to get to the simple 3-letter word, because this is the difference between good and great. Dr. Kaplan will often say, do you want to be good or do you want to be great? So I'm going to ask you, doctors, here on this webinar, do you want to be the best? Because I didn't get in this business 33 years ago to sit on the sidelines. I didn't get in this business to be able to be good. And if you came to this certification this weekend, I showed something that in 33 years, I've never shown anyone but my family, ever. I was so honored to show it. I showed the actual video and pictures of how to get 20 new paying patients per day, how I was getting 20 new paying patients per day every single day for 4 straight years. And where they would line up, and the doctors, I saw the look on your faces, doctors, and it was worth it all to be able to show that to you. Maybe I'll show that again at some point. But my question to you, doctors, is this, and that is simple, and that is, do you want to learn more about how to capture your market? And if you do, then this is an opportunity that is one of a kind and is really just one time. So what I would share with you is simply this. There is a training that is coming up, and it is known as the Neuropathy Masterclass. It is a singular 1-day training, and it is a certificate program for 1 day, where you doctors will very simply learn everything, and I mean everything, that you can in 1 day from the best of the best of the best. The biggest players, the biggest doctors, the biggest clinics in the United States will be there teaching everything, and I mean everything, about neuropathy, about the evaluation of neuropathy patients, the treatment comprehensively, all the new technology. And I know if you were sitting there, if you were sitting there this weekend in our certificate program, you saw some of it, but the truth was you didn't see all of it. And the reason you didn't see all of it is because we were waiting for the masterclass to share this with the most captive audience. And we've got some marketing for this audience that will wow you. It will blow you out of your seat when you see this. I cannot wait to share this with you. And then the financials, in other words, how to package this the best. So if you're curious about how to get all of this in your shopping bag of neuropathy goodness, then you will have an opportunity to do this. This is a full neuropathy hands-on training. In other words, you will be able to learn hands-on. All the equipment will be there. All the technology will be there. And you will have an opportunity, doctors, to be able to learn from the principals of each company, not the salespeople, the principals of each company here, to be able to learn how to implement technology. And you know what the best part is? There's nothing for sale there. In other words, you don't have to buy anything unless you want to, of course. But the truth is that you will be exposed to the best training, the best hands-on neuropathy training in one singular day from the best companies, the best doctors, and really the best pool of talent all in one single day. And yes, you will receive a gorgeous certificate. However, and I think it's important, I know if I'm listening to this webinar, I'm saying I am all in. Tell me what to do. Show me what to do. I need to know. I want to know from my patients, from my practice, from my team, from my family. Just tell me what to do. And when I say, however, I have to make you aware of the simple fact that this incredible masterclass is only open to concierge coaches, clients, and NeuroMed NeuroDoc centers. And it is our gift to the family of doctors here with respect to, this is a closed door meeting. This is a private meeting. And it is 100% sold out. In other words, when I say 100% sold out, we've already, believe it or not, we've already outgrown the room that we had booked. So I know what you're thinking right now. You're saying, well, gee, wasn't Dr. Kaplan supposed to give this webinar? The answer, doctors, is yes. If you read it, it was actually Dr. Kaplan who was supposed to teach this webinar after he left his heart in not San Francisco, but he put his heart out there this weekend. But guess where he is right now? He's signing the papers right now. And you could ask him to get the most 5-star location you have ever seen to train. And I think you guys know where it is. It's going back there, you bet, because we outgrew the room. I know it sounds crazy, but we actually outgrew the room because of this past weekend. Everybody jumped all over it because, remember, we made this available to the doctors who were in attendance first before we shared it with anybody else. So here's how it works, because there are some other options to learn if you're not part of our family of concierge coaches, doctors. There are some other opportunities to learn here. So let's give you a few options here on how you can go about doing it. So option number one is to call this number, 888-990-9660, and to see if there's openings here. Excuse me. If there's openings here for acceptance in your market. Now, the truth is, most of your markets have been taken. This week, if you were sitting there, you know what I'm talking about. You were sitting in the room this weekend, and your areas were already taken. So you got an email from us. It was a very cordial email that said, we're sorry, but your area is taken. And life favors the doctors that took action. And I'm talking to you, Dr. Leo, because I actually know you're on this webinar right now, and you know that we had to do that for you. And it was our honor to do that for you, to protect your area. You know what I mean? Because you're a cool dude, man. You are. That's option number one. It was our honor to protect your area and do more. But let's see, in other words, if there are some potentials here for you. But there are some other options here, and I'm going to go over with you, and then I'm going to share an amazing bonus with you. We're almost there, but I'm going to shock you. All right, I'm going to do something that is really incredible. Option number two is this. You can go to www.thecheiroevent.com, because this is actually, believe it or not, this is actually a 3-day training. Now, in a singular day, we're going to do the neuropathy masterclass. But the day after that, there's actually something that everybody's invited to, and based upon seating, of course, every single one of them sold out. So if there's seats available, you can go to www.thecheiroevent.com and see if you can secure a seat, because this is actually the third day. So yes, we will be showing some of the marketing that we're showing the prior day. So if you want to come and you want to learn about spinal decompression, you want to learn about joint care, you want to learn about market penetration, you want to learn about social media, you want to learn about all of that, nothing to sign, no pressure, no obligation. You'll have a gourmet lunch in the most beautiful locale. And it is a private club, by the way. And when you go to the website, you'll see. And if your name is on the list, the gate will open up and they will let you in. And if your name is not on the list, then the gate doesn't open up. That's just how it is there. And so that's option 2. So if you're watching this, you say, you know what, I'm curious. Let me just see what's going on. And maybe I can hang out with some of those neuropathy doctors because they're going to be there anyway, the third day anyway. But they're actually there for the day before. So you have 2 options here. Number 1, you can see if there is a seat available for you at the Neuropathy Masterclass. You can call that number, or you can go to the Chiro event for a private mastermind there, which is, as I said, which is open to everybody based upon seat availability. But here's where it starts to get really interesting. And here's where, for the doctors that hung out, and all of you, I am looking at your numbers right now. I can't believe you guys, some of you must have come late, but there's like way more people on this webinar right now than when we started. So you're here for a very special bonus. And we've never done this before, so I think it's kind of exciting. I think that's an understatement. We're going to do something pretty freaky, and that is this. For the doctors that are actually able to secure a seat for the Neuropathy Masterclass, the day before and this is included as part of it, the spinal decompression boot camp will be taught. Now, historically, this has always been a 9 to 5 event, but what we're going to do is we're going to do an intensive event that day from 11:30 to 4, the day before on the Thursday. And so, in other words, if you're in the disc business, you want to learn how to package because there's a lot of carryover to the next day because there are a lot of similarities in terms of the positioning, the packaging, the communication, the overcoming objections, the financials of being a disc doctor versus being a nerve doctor. So this is actually how the agenda works. Whereas number 1, and you can come to 1, you can come to 2, you can come to 3, okay? The first 2 are, again, for our family of doctors only. Spinal Decompression Boot Camp, day 1, Neuropathy Masterclass, which I guarantee will go way past 5 o'clock that day because we've got so much stuff to show you. I have a feeling this is going to be an all day, all night thing, but guess what? We're going to feed you. We're bringing in like amazing gourmet food. You won't have to go anywhere. You're going to love it. The location speaks for itself. You know we always do things 5-star. It's such an honor, but you ain't seen nothing yet. And then if you're curious and you say, well, gee, you know what? Let me just come to the Chiro event. You can as well. You'll have to go to that website. And my question is this. If I'm on this webinar, I'll say, wait a minute. This is like way, way, way too good. They're giving the house away. What does it cost? And the cost here is very simple. And if I've ever asked for a drum roll in my entire life on a webinar, this is the moment of the drum roll. Our family of doctors, and if you're not part of our family of doctors, all you have to do is call that number, 888-990-9660. I will flash it one more time. Can attend all 3 days for free. And if you've asked anyone, and I challenge you, if you're listening to this webinar, to speak to some of our doctors who've attended these courses, and they will tell you it is the single greatest training they've ever been to. These doctors were in attendance this weekend. The room was packed. They loved it, and you're looking at some of the most progressive doctors in the country, and you will get a chance to meet them. But guess what? It gets even better. And if you're curious what the free bonus video is, we decided to do something, again, that is unheard of. And what we decided to do for you guys was this, and that is for anybody who is fortunate enough to grab a seat at the Neuropathy Masterclass, we are going to give you a highlight reel of the entire National Peripheral Neuropathy Certificate Program, the highlights, the best of, and bonus footage. If you remember, we had 2 camera crews. We had multi-camera setups there. We had cameras from the front. We had cameras from the back. We had another photographer capturing everything, and he was doing an exceptional job. And it's just so what we decided to do is our gift is like the highlight reel. It is an hour log of the training, which we are sharing as our bonus gift. And this is where, one of the great things was the clinical portion of it. So that's why the masterclass, if you are into learning how to diagnose this better, how to measure this better, how to evaluate and do a differential correct with technology, well, guess what? You ain't seen nothing yet. This is one of the most incredible trainings that you will ever attend. If I show you the text and the emails and the messages just from this past weekend, and now we were just scratching the surface because we knew what we had in the pipeline, and we are almost there, and it is not too late to secure a seat. It's coming up, and what you want to do is you want to call that number, and you want to learn from the best doctors in the country. You want to be in the party of parties, because this will be a party. It is a 3-day event. Again, if you're just into the neuropathy part of it, you can come to the masterclass. You can get the bonus the day before. If you want to hang out the day after, you can. Or if you just simply want to come, if there's seats available, to the Saturday event. And it's incredible. You will learn from doctors that will share some incredible tools that they are using right now, and some brand new technology that will knock your socks off. Because at the end of the day, if you surround yourself with goodness, if you surround yourself with doctors that are progressive and moving forward, that are some of the best peripheral neuropathy doctors in the country, you will come away better. So you have a few choices here. You can come to the Chiro event. Go to www.thechiroevent.com. See if you can secure a seat. If you're not part of our family of doctors, if you're curious about it, then coming to Masterclass, then I will flash that phone number again, and you can call that phone number. Tickets are on sale right now for the Chiro event as we speak at this moment. Everyone who's ever attended will tell you that every single one of them sell out. So this one especially will go faster, because I have a feeling after this webinar, there will not be any seats left after it. So if you see a pop-up box that says, do you want to go to a wait list? You will be given a choice, yes or no. If you click no, then it'll just, then the website, that box will click off. If it goes yes, then you'll be given an opportunity to go on a wait list. Historically, most of the people on the wait list don't usually get in, because nobody gives up their seats. Usually only about 10% get in, but you're given an option. You'll see the pop-up box, but go to the website. And I don't have to tell you this, but I'll tell you anyway. If you want to spend the $99 to come on Saturday and you're not blown away, then we'll give you your money back, and you can keep every bonus that we give you that day, because we have an incredible amount of bonuses that we give away on that Saturday. As I mentioned, it will sell out. And again, to go back over one more time to allow you the opportunity here, if you want to come day one, if you're part of our family of doctors, it is wide open. If you want to come too, it is always wide open. See, I can always say it's wide open for our family of doctors, because they are given VIP concierge, wink, wink, hence the name, entrance to these events, because the seats that we hold are for them. But it's not too late. You may be given an opportunity to become part of the most incredible family of doctors. And then again, the Chiro Event Mastermind, again, what is the cost? You can attend, if you're part of our incredible group of doctors, all 3 days completely for free. And again, you will come away, if you're able to secure a seat at the peripheral neuropathy certificate program on Friday. This will be a full-blown training. You will get the hour bonus video. This is only available to attendees of the peripheral neuropathy masterclass on Friday. And again, it is a best of. I've already seen some of the highlights, and it'll knock your socks off, because it's so first class. And you saw who filmed it. The guy who filmed it is the guy who films a lot of our commercials for our doctors. And he was just like so dialed in that day. And he already showed me some of the footage, and it's spectacular. Dr. Kaplan at his absolute best, and I mean the best. I mean, he was just so from the heart this weekend, because he wants you doctors to win so bad. He's incredibly competitive, as you know, but he wants you to win. And he wants our doctors to be able to be certified. He wants them to be accredited. He wants them to be awarded. He wants them to be trained in the best training that's available today in the neuropathy universe, and to be able to surround yourself with some of the best doctors in the country and to hang out with them, because these are cool dudes. These doctors are fun. They're progressive. They're outgoing, they're energetic, but don't be fooled. They are the best peripheral neuropathy doctors in the country, and they are there to share with you. And if you can put yourself in the same universe with them for full-blown training all day long, well, guess what? That's how you move the needle. That's how you get ahead of the curve. That's how you outperform your peers. That's how you win the game of practice. That's how you win the game of life. And that's how, doctors, you're able to, as we say, collapse time frames, not elapse time frames. See, unsuccessful people will elapse time frames. They will find things to fill in the time that don't move them closer to the goal. Successful doctors, the doctors that are listening to this webinar, I'm talking to you doctors, that understand that we are on the clock. And we are on the clock because you have an opportunity here to condense your learning and to be able to bring a better package to your patients Monday morning. So what you want to do is this. Again, 2 simple options. You can go to thechirovent.com, or if I'm you, without question, I am calling this phone number, 888-990-9660. If it goes to voicemail, it means they're on the phone. It's just how it is. I actually have 3 people right now manning the phones right now because we knew what would happen after this webinar, because we had so many people sign up for this webinar because of the momentum of this past weekend. And that's why we outgrew the room. We're taking a brand new room at a place that is 5-star. You know where it is. If you go to the website, you'll know it is a private club. And if you are admitted, you will be in one of the greatest environments to surround yourself with goodness, success, and great doctors and learning. Call that number. And if you want to actually learn a little bit more, I did not post yet the bonuses on the website. And the reason I didn't post the bonuses for you guys is because I wanted the doctors who were listening to this webinar to have first access. So that's what we do. If you stayed for the webinar, which you obviously have, we wanted to make the bonus videos and entrance to the event and to the masterclass available to you on a first come, first serve level. So go to, if you want to learn a little bit more, you can go to neuropathymasterclass.com. But if I'm you, I am without question calling this number, 888-990-9660. And I cannot thank you enough for listening, spending time here. Look at all you guys, oh my gosh, who hung out this long. Dr. Leo, Dr. Kendall, look at you, man. Dr. George, Lee Cow. Well, all I can tell you is I'm going to see you at the Neuropathy Masterclass. I can't wait to see you. Wait till you see all the stuff we've got for you, all brand new tools, and you'll be with some of the best in the country. Call that number now. And on behalf of Dr. Eric Kaplan, this is Dr. Perry Bard, and on behalf of some of the absolute best peripheral neuropathy specialists in the country who you will meet live at the Neuropathy Masterclass, do everything you can, doctor, to try to secure a seat. This is a one-time only event, and we hope to see you. Thank you so much for listening, and we will see you live at the Neuropathy Masterclass.